Nearly half of the states in the United States allow medical marijuana. Wisconsin is not one of them, but the topic of medical marijuana comes up a lot in the news these days and among medical professionals as well. Joining us today are Drs. Maz Bradbury and Christoph Zaremba. Thank you both for being here.
Thank you for having us.
Dr. Bradbury, 23 states have legalized medical marijuana, 2 have decriminalized it, and Wisconsin has taken no action on it. What is your opinion as a medical professional?
So I should qualify my opinion by stating at first that we both believe very strongly that marijuana should be decriminalized overall as a drug due to the various social ills that marijuana law enforcement have impinged on us. The problem is that as far as medical marijuana goes, we also feel that there is no basis in evidence, there's not a strong enough basis in evidence for us as medical professionals to recommend it as a medical treatment as such.
Dr. Zaremba, what's your opinion about it?
So a big problem with using marijuana in the clinical setting is dosing. For example, if a patient comes to your clinic with high cholesterol, you prescribe particular medicine with X amount of milligrams, however many times a day, and the patient follows up and the dose is increased or decreased, and the patient's monitored until a desired outcome is observed. With marijuana, however, even between plans, the potency varies so much, and the route of administration in terms of how long you hold your breath dictates how much of the THC is absorbed into the bloodstream.
Is marijuana addictive?
Yes, it is.
There's no question about it.
There's no question about that. It is not as addictive as other substances that we think of as addictive, cocaine, nicotine, whatnot, but there is a well-documented addictive potential for marijuana.
So does that make it a slippery slope then? Is marijuana a gateway drug?
There has been evidence that shows that it may be a gateway drug, but with the proper regulation, we believe that the benefits far outweigh the potential costs.
And do you think it's just a matter of time before Wisconsin goes the way of other states in the country?
We would certainly like to.
The momentum in that direction.
We would certainly like to think so, given that marijuana law enforcement has a totally disproportionate effect on those in society who are often less fortunate and less privileged in the eyes of the law to begin with. But with that said, we don't feel that it is the role of physicians and for the medical profession to be sort of the venue through which that ultimately virtuous motive is taken to its logical end.
And are the medical benefits of marijuana still debatable, or do you think the science is definitive now?
Many very well executed randomized control studies have shown that it's clear cut that their benefits exist. Even opponents of medical marijuana will admit that there are benefits. However, they believe that those outweigh, or rather the negative side effects outweigh the benefits.
And to people who say, we already have enough problems with cigarettes and alcohol, why take this on from a medical perspective? Your response would be?
So, first of all, I mean, medical marijuana, or marijuana laws in general, don't work. The prevalence of smoking cannabis is very high. It's ultimately much easier to obtain for adolescents than alcohol is. And with that in mind, we think that just because marijuana may not be good for you, because it might be dangerous to your health, that doesn't mean that our current legal paradigm is one that's most effective for keeping it as small of a public health problem as possible.
And do you think it's just a matter of time, or do you think Wisconsin will keep the status quo?
I believe it's absolutely a matter of time. A lot of opponents believe that adolescent use will increase, but many studies have shown that since 1996, California has medical marijuana, and their adolescent use has not increased.
Very good. Well, we'll have you back as soon as things change in our legislature. Doctor, it's good to see you.
Thank you very much
for coming in tonight.
Thank you.